Hi, good afternoon. This is your County Executive Ed Day. We're here for our weekly COVID-19 update. We have a very tight timeline today. There's a lot of things going on over here. So we're going to jump right into the questions. We only got a few of them today. I'm going to turn this over to my Director of Communications, John Lyon, and he'll handle the question end of the broadcast. John?
Okay, thank you everybody who wrote in today. First question, which is really multiple questions. What is the hospitalization rate here in Rockland? What is our 3-week projection? Will we near the capacity that the governor's talked about?
Okay. First of all, the governor has said that hospitalization capacity is projected to hit 90% within 3 weeks for any of the New York State's 10 regions. He will shut the region down entirely. That includes non-essential businesses. Now, while you've heard me here before, I do not agree with that as an appropriate strategy. The fact of the matter is it can become a reality under the governor's emergency orders. Our hospitalization rates here in Rockland have been steadily increasing. Yesterday, they increased from 66 people who were hospitalized with COVID to 81 people. So it went up 15 people in one day. That's a significant jump. Just so you do know, we have regular routine conversations with our hospital CEOs and upper-level management to maintain a sense of what's going on there. But the last time we had these many people hospitalized from COVID was back in mid-May when we were still under a lockdown. So we can't ignore this, obviously. It's very, very important. These numbers are telling. And they should be concerning to every resident of Rockland County. Look, gatherings of all sizes, parties, get-togethers that flaunt the basic precautions of social distancing and mask wearing are incredibly irresponsible. They're putting all of us at risk. Look, these are the only tools we have at our disposal. We can debate all day whether they work or they don't, or the return of this alleged second wave kind of indicts the fact that this works. That's all we have. And common sense dictates to us that with a virus, anything you can do from a hygienic perspective to prevent that from getting to you is a real smart thing to do. So with hospitalizations increasing, we must do what we can to limit the spread of this disease, or we will again face a shuttering of local businesses by the governor. Nobody wants to see that. But you know, it's not just our economy and freedom of movement, of action, that's at stake here. Lives are on the line. Since Thanksgiving, 21 people have tragically died from COVID-19 related deaths. That's a significant number. That's telling us that the virus has returned and has returned stronger than we've been seeing it over the summer. When it comes to our 3-week projection, which was part of the other question that was asked, we in county government do not have access to whatever projections the governor is using. I don't know why. It's just the way things are being handled in Albany right now. But I can say that despite the recent increases, there is still capacity within our local hospitals. There is roughly 22% general hospital bed capacity and over 70% ICU bed capacity. These numbers are publicly available on and updated daily on our county COVID-19's dashboard at rocklandgov.com. One of the things we have to understand, we cannot stress the hospitals. That affects all of us. So anybody who's out partying, any group who is flaunting the rules, you're not just risking people in your own area or in your own community or in your own family. You're risking everybody else, because when you get sick, that's another bed that's being taken up, and that's really a critical issue. You've heard me speak to this before, that one of the most important measures we have, we said this a number of weeks back, is the hospitalization rates. That's very important. It tells us a lot. It tells us more than the infection rates, and it tells us more than the fatality rates. So you can access all this by visiting rocklandgov.com, and we will also post a direct link in the comments section of the Facebook page.
Okay. The next question, what are the updated yellow zone areas? The map on the New York State website has not been updated since November 19th, and the numbers here in the county still continue to rise. What can you tell us about that?
Okay, well, there haven't been any changes in the yellow zone areas within Rockland. That's the reason why you have seen no changes. The zone designations are made by the governor's office, and and that goes for all my fellow county executives in the state, not just our region. We have very little input into that decision-making process. We tried many things over the course of the last number of months to get back into a reopening plan when things were calm. That would have been very helpful. Now, obviously, it would be reckless to be doing certain things. But when we had this virus driven down to the basement, that was the time to continue the reopening plan, and the state did not do that. It's a source of frustration for me, source of frustration from all the county executives that I do know. But we have not heard any changes are pending, but we must unfortunately prepare for the possibility. The latest info on these zone restrictions and the extensive frequently asked questions are available on the forward.ny.gov website. That's a state website. We will include a link in the comments section at the conclusion of this video.
And before I get to the next question, just to address a question that was in the chat, asking if there's a differentiation between flu and COVID when it comes to these numbers, particularly the deaths. They do. Every COVID-19 case that we report is from a positive COVID-19 case.
Right.
This is something that our medical examiner gets and reviews. This is not just numbers that we're making up here. On to the next question. How will you determine vaccine distribution? The person who wrote in says they are 2 people over 80 with pre-existing conditions. Will we be notified when it's our turn by the pharmacy or healthcare provider? And do you know how many doses of vaccine are coming to Rockland? How much is available?
Okay, we're going to tell you what we do know, but let's be very clear about this. The decision of dispensing with this vaccine is not rest in the county, the town, the villages. This is going to be directed from Albany, probably with some interaction with the federal government. But we'll tell you what we do know here. Distribution is being determined by the state and the governor. That's the bottom line. They have announced already that long-term care facility workers and patients, like nursing homes, adult care, etc., will be provided with vaccine after New York receives an adequate supply. What we know so far is New York has opted into the federal government's nursing home vaccination program. Many of you had seen the back and forth that was going on with relates to vaccines. I am extremely happy that the governor and the president have calmed down and are start working together now, because it was very frustrating to see that kind of battle at that level of office. It's just not the way we deal with things. So that's a positive. Under the federal program, you may have heard this. This is similar to the way things are done with the flu vaccine. Employees of CVS and Walgreens will vaccinate residents and staff at these adult care facilities. Again, as I said, much like they do with the flu vaccine. So they're working within a proven strategy right now as it relates to that. New York State expects deliveries for this program to begin arriving next week, and for the program to begin by December 21st. New York is dedicating a portion of their initial 170,000 doses to this program. Portions to future state allocations will also be used to help complete the program and ensure all residents and staff of these facilities are vaccinated. It has not yet been determined where or specifically when vaccinations to other individuals will take place. We also do not know exactly how many vaccine doses will be coming here. We have been told that there should be enough to vaccinate all of the staff and residents of long-term care facilities. While we await further information from the governor and New York State, I want to be very, very clear to all of you. We are standing more than ready and willing and able to assist in whatever manner they ask. Our top personnel from a number of county departments who will be affected by this. It would include departments such as health, obviously, emergency management. Purchasing is obviously intimately involved in this kind of process. They're already in the process of establishing an action plan designed to immediately deploy as necessary when we get the word from the state. This effort is being directly overseen by the Office of the County Executive. I see this right now as a battle of our generation. That's what we're going to be looking at. The governor's made it very clear logistically this is going to be one heck of a challenge. You have a lot of talented people here in Rockland County who are used to handling crisis and emergencies. I can offer one of the skill sets I bring here is a background in emergency management and crisis management with 2 police departments at the command and executive level. So these things will be all applied to make sure that whenever we get the word, we are ready to jump immediately at the situation and be able to work to get these vaccines out to all of you.
Okay. Thank you for that. When we get into the next question, I know some other people have been watching this. I have been watching it all day. Right now, The FDA's Vaccines and Related Biological Products Advisory Committee is currently meeting on the Pfizer vaccine and whether they're going to move forward with emergency use authorization. We don't know, that the hearing's still going on, but there's been a lot of good information presented, a lot of good questions asked. But this last question is on everyone's mind right now. Are the vaccines safe?
Right.
And do you trust the people at the FDA deciding and saying that these vaccines are safe for everyone?
You know, I think the transparency that John was just talking about, that some of you have been watching, should assuage some of the concerns that are out there. Look, the full safety data has not been made available yet, but no serious safety concerns have been reported in either the Pfizer or the Moderna trials. Intensive safety monitoring will also continue after the vaccines begin to be used. Now, the side effects that we've seen, the profile of Pfizer vaccine includes pain at the injection site, includes fatigue, chills, and fever. Not unusual reactions to shots. The side effects that were noted in Moderna's news release include pain at the injection site, muscle aches, and headaches. So we see similarities there. And this committee that held a public meeting earlier today, and it's still ongoing right now, to review the Pfizer campaign and recommend whether this should be cleared for use in health workers and other vulnerable populations, is made up of external scientific and public health experts from throughout the country. And as you see, this is a public process. The entirety of it all is out there for all to see and to weigh in on. After their review and recommendation, the FDA career staff must sign off on any possible vaccine. Now, from a professional perspective, the fact is that the FDA staff are career scientists and physicians who have globally recognized expertise in the complexity of vaccine development. Moreover, that recognition also includes evaluating the safety and effectiveness of all vaccines intended to prevent infectious diseases. These FDA professionals are committed to decision-making based on scientifically driven evaluation of data that they have in hand. So that should provide some calm, but let me drill down a bit, because the issue of trust isn't always something you can look at numbers, you can look at logic and just kind of go along with it. You know, I would say this from a perspective of trust. Since you're asking me, I would say this: despite what you see, some of these fantastic plots on social media, the fact of the matter is the FDA staff are like you and me. They are fathers, they are mothers, their daughters, their sons, their sisters, brothers, and more. They are their families they and their families are also directly impacted by the work that they do, just like we are impacted by it, and are exactly why you want making these important public health decisions for the United States. Between the efforts of those in the vaccine manufacturers, there is indisputable history of their collectively eradicating some of the most dangerous diseases known. So yes, I do place trust in them, both in the same feeling that in my gut that I had when I was in law enforcement, that kept me safe, and plus the facts that history has provided for us as it relates to this process. I hope that provides some sense of calm, just the fact that they're not jumping to immediately pushing this out, I think says something right out of the gate, that they are being measured but responsive, and that's what we're looking for right now. The last question, John?
That was the last question, and just before we move on entirely from this subject, the one update that the FDA sort of put out earlier today was that the decision on this will not necessarily come today.
Right.
It could be tomorrow, it could be as much as a week from now. So while I know a lot of people were expecting them to sign off on it today, to me, seeing that they're not doing it immediately, that they're asking these questions, going through the process, shows that they're asking the hard questions and looking at this data. And it makes me feel better about what's going to happen next.
And I would absolutely agree. One thing I'd like to close with that's off topic here, something that's critically important regularly here in not just Rockland County or the state, but in the United States of America and the world, the issue of donating blood. You've heard me before. I probably am in real pain when it comes to this. I push this all the time. I donate blood pretty much almost every 58 days when I'm allowed to. We're having another blood drive here. Our County of Rockland, our employees are putting this together in conjunction with the New York Blood Center. This will be up at the Robert Yeager Health Center in Building A at the Exhibition Hall. That's the main area. This will be Wednesday, December 16th, between 8 a.m. and 2 p.m. there's an urgent need, especially given the dynamics of this pandemic we have. Blood donations are down. Blood transfusions in crisis can save lives. I've had the really sad experience of seeing some very tragic situations in my life, and to watch what's necessary to keep people alive. A blood supply can be emptied out in no time flat, and that emptying out could happen, and it could be a member of your family, it could be your neighbor, it could be people, somebody you know. It's a gift, and it's a very easy gift to give. Doesn't hurt. They actually give you cookies and orange juice. It's pretty cool. But most importantly, you're contributing back to your community, and you're doing something that's going to save a life. It's not maybe, not if. Your donation will save a life in one way, shape, or form. And again, that life could be someone dear to you. So I would ask all of you, please take a moment this Wednesday, December 16th, between 8 a.m. and 2 p.m. to partake in the County of Rockland's blood drive. When we run them regular, I will be up there. So if you want to, share some of your thoughts with me, you can probably catch me sitting in bed with the needle in my arm, and we can have some cookies together. But seriously, please try and be a blood donor, because it's, again, very, very helpful to this community. So, yes.
And I will post the link to sign up to register to donate. You can pick your time slot so they're ready for you. You're in and out of there in, half hour, 45 minutes.
So it's no excuses. It's just very easy. Make a reservation and you're good to go. So with that, again, it's trying times, but I've said this pretty much every time we speak. I have belief in faith in the people of Rockland County. Believe in the good Lord getting us through this, and I have belief because I've seen this in crisis before. Everything that Mother Nature has thrown at us, we've been able to defeat, and we're gonna win this one as we have won every other battle we have fought together, because we're Rocklanders and we believe in each other and we believe in that strength. So with that, have a wonderful afternoon and evening, and let me not forget, sundown tonight, I'm wishing my friends of the Jewish faith happy Hanukkah, the Festival of Lights. Please enjoy. We're going to have a quick, a small gathering within the limits, obviously, in front of the courthouse, in front of the offices today, just to acknowledge that we had the creche a couple of days ago. Dedication was done. So we have both the Catholic religion, or the Christian religion, and the Jewish religion are expressing their beliefs here over here at Rockland County. So again, have a wonderful evening, and we'll see you next week.